We're pleased to welcome Barry Ostrowsky, President and CEO, RWJBarnabas Health. Good to see you, Barry.
Great to be here. Thanks, Steve.
You've talked to us about a whole range of health and related issues on so many of our programs. But on July 27, 2017, a major announcement took place between your organization and Rutgers. Talk about it.
Well, I'll tell you, our partnership with Rutgers, which is that which we announced on the 27th, is perhaps the most transformational initiative we as a system have ever undertaken. And frankly, I think it's transformational for New Jersey. We've long been committed to medical education. We've long believed in medical research, but there really hasn't been a vehicle to take the state's largest healthcare system with the State University, which is an internationally renowned educational facility that does research, put it together, combine the strengths of those two organizations, and in fact have a blueprint by which we can invest in academics and in research, build programs that'll cover New Jersey. So for us, it's terrific. I think it's great for the Rutgers University and for the state of New Jersey.
You know, you and I were talking about impact right before we got on the air here, and you talked about research. Let me talk about it from an applied perspective, translation. The impact, the potential impact on the healthcare landscape in the state, and frankly, more importantly, more specifically, the consumers of healthcare.
That's what this is all about. Of course, our mission is to make the lives of the people in New Jersey better, no matter how we can do that, whether it's addressing social determinants, or whether it's delivering healthcare services, or whether it is, in fact, discovering new healthcare services, new techniques. And so medical research is not simply an academic affair. It is, in fact, an attempt to make healthcare services better, to determine how better to treat people with conditions and illnesses. And of course, what you just suggested, what is that translational process? And so when you put a big delivery system together with a university like Rutgers, you can accelerate the translation of that which you find in a laboratory to the bedside. And it's not inexpensive, it's a commitment, it's an investment, and it's certainly anything but casual. So part of the motivation behind the partnership that we formed is to accelerate this translational research so that it can impact the consumers. Everything we do, candidly, is about the consumer. That is our mission. How do we make your life better, your neighbor's life better, the community in which you live better? And we think this partnership will enable us to, in fact, attain that goal more easily.
You know, put this in a national perspective, if you could, for us, Barry. There are some research-based universities that are actively involved and are branded, dare I use that term, in the healthcare community with other healthcare institutions, and they really stand out. Is this different from that and a New Jersey way, the New Jersey approach to achieving that, or is it totally unique?
Well, I don't know that it's totally unique, but you and I agree that New Jersey has a number of unique characteristics. And the truth is, since we're focused on the people of New Jersey, it has to make sure that it fits comfortably within the New Jersey culture. But I will tell you that the goal here is to make New Jersey a destination for healthcare service, academics, and research. By the time this partnership begins and frankly gains the traction we know it will, people will be looking at New Jersey and talking about this partnership in the same paragraphs as you were to mention any of the other great nameplates throughout the country. In those cases, they've begun these earlier. In this case, we're just beginning it now, but New Jersey is in fact a place that people will come in order to get the kind of healthcare service that they deserve, and they'll be getting it from this partnership of a great university and a great delivery system.
You know, as you know, I'm fascinated by questions of leadership and organizational communication, et cetera, and I've, to disclose, I've done a fair amount of coaching around leadership and communication within your system, the system that you lead. But what I'm fascinated by is two very large institutions coming together. Does it look like this? Or is it, I mean, without getting into the weeds on this, it's a challenge.
There's no question
about it. Well, worth
it,
it, but a challenge.
It's a challenge, but these are two successful organizations highly confident in their expertises. And that's important.
Explain that, what that means.
So Rutgers understands that it's a wonderful academic organization, has a great track history in all areas of research, and it's confident that it can continue to perform that well and better through this partnership. We're highly confident in our ability to manage healthcare facilities, physicians, to deliver great clinical care, and integrate with our communities. So when two partners get together, each of which is highly confident in what they can do, they have to sit down and decide, if we did it together, would it make it better? And so we spent months figuring out how putting it together would make it better. And it's trite, but 1 + 1 will make 3 in this case. And so, yeah, it's not easy because we're both very much firmly committed to our pre-existing missions. Now there's a new mission, and we've each subscribed to that enthusiastically, I have to tell you. And I must say, the board of our organization, which is a great board of trustees with incredible insight, has in fact suggested to management that we pursue this in earnest and do it quickly and effectively. And so there's great enthusiasm around this, but it's going to work because each of us will rely on the skill set that we bring to the partnership. And I think by further developing that skill set, we're going to get great results.
Last question. We are in Newark, and Newark Beth, one of the crown jewels, if you will, of the system, RWJBarnabas Health system. I know well because members of our family, especially my dad, treated there for many, many years, and the heart program, heart transplant program. The 1,000th heart transplant has taken place at the Beth.
Unbelievable. It's an incredible accomplishment. The Beth is a jewel, certainly in any system, and thankfully it's in our system. I was born at the Beth, so I have a particular interest in it. It developed initially the Great Heart Program in New Jersey and began the first heart transplant program in our state. And as you say, did their 1,000th, which they've already exceeded, heart transplant. If you look across the country, there are only 11 hospitals in the history of the United States that have ever exceeded 1,000 heart transplants. And here, one of them is in Newark, New Jersey. The innovation at the Beth has historically been at the top of the list. And so we're so proud of the professionals and the rank and file and the leadership team there for this great milestone. And there'll be more to come.
It's a big deal.
It really is a big deal, worthy of celebration.
Barry Ostrowsky is the President and Chief Executive Officer of RWJBarnabas Health. We talked about the Rutgers partnership and collaboration, and also the 1,000 heart transplant. Thank you, Barry. Appreciate it.
Thank you, Steve. Appreciate it.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by New Jersey Sharing Network, the Healthcare Foundation of New Jersey, JAG Physical Therapy, Georgian Court University, Valley National Bank, Verizon, and by Fedway Associates.